What are common treatment options for tendinopathy? So typically if someone comes in with a tendinopathy, which is a tendon problem that ranges anywhere from acute inflammation of tendinitis to chronic inflammation with tendinosis, we start with the most conservative options, and a lot of patients have already tried some of these on their own. Step one is to start with some rest, over-the-counter medications, ice, heat, and things that you typically can do on your own at home. If those things aren't working, the next step would be to see a physical therapist, and they would work on strengthening and stretching and other modalities to help with the tendon. Tendons need load to heal, and so the physical therapy piece is really important throughout this whole process, even if you need to move on to step 3. Step 3 would be injections, so most commonly with something called platelet-rich plasma or PRP, or corticosteroid or cortisone. Then step 4, if all of these things are not working, are tendon debridements under ultrasound guidance. So these are using devices that break up the scar tissue in a tendon. It's done with use of ultrasound through a very small stab incision that's less than 3 millimeters. And it's basically has converted an open surgery to a very small procedure. The recovery after these procedures is a little bit more similar to a surgical recovery, where we have you immobilized or not using that body part for a couple of weeks. And then over the next 6 to 12 weeks, you're gradually progressing back to your previous activity. If all of these options are unsuccessful, then we can consider surgery, but in the vast majority of patients, we don't need to go that route.